let me start from the beginning. Um, yeah. Also, so before I start with the Q&A, you have a $60 discount if you're not in the program and you want to join. So you can get a discount for the first month. You have a coupon code here. So if you want to join, just use it. Why not take advantage of it? Let's start with the questions. Do you need a journal for awareness training? So as I said, you can use either our app or just whatever app for making notes on your phone, or you can use a journal. You can actually combine these. Having a traditional, like pretty big, nice journal is really fun for a lot of people, myself included. I really like journaling, but it is not very convenient to carry it around with you. So maybe in the moment when you pull or think that you will pull, you can just write it down on your phone, and then in the evening just take 10 minutes and put it in the journal. That's maybe more practical. So you can use the app on your phone and then later on copy it in the journal. I forgot to mention one more thing that might be useful, which is the app. Because we, well, not well, I say we as in Trickstop people, but I didn't program anything. But the app was programmed in such a way that it's completely detached from from the therapy, from the paid program. So even if you join the program, if you want your therapist to be able to see your entries, you will have to share it with them. And the reason why I'm telling you this right now is because the app will convert all your logs into a PDF file. So you can email it to yourself and then print it out and then look for patterns that way and plan your competing responses based on that. That's quite a useful functionality. Can you give an example of a utilized competing response? Well, I gave example of about a dozen there. I hope that was enough. If not, please just clarify your question, and I will try to be more precise with my answers. When we are in the awareness stage, should we be using two responses or just focusing on the awareness stage? So while you're in the awareness stage, I suggest that you just focus on developing awareness, because self-monitoring is a lot more work than people suspect. If you start implementing competing responses and continuing your awareness training, it's really very tedious and complicated, and then people just tend to be frustrated and just give up. So first, do the awareness training. Make sure that you're able to outline everything that I mentioned there in one of the first slides, and then just proceed to use competing responses. You need about a week or two for awareness training. I suggest 2 weeks, but that really depends on how extensive your pooling is and what the focused versus automatic ratio is and stuff like that. And another thing that I would like to add to this is that if you start implementing competing responses, you can still use, let's say, elements of awareness training to log those moments when competing responses didn't work or when you chose not to use them. Those would be very good things to write down, and then also write down your logic or your justification in the moment, because that way you will be able to understand why is it that you choose not to, or how does it come to that point where the urge is so strong that you can't resist. And there's also another thing: if you find self-monitoring tedious, there is a way to make it less stressful and less difficult, which is to self-monitor. I see that a lot of you are raising your hands. Just please add your comments, and I will answer. I promise I will answer them. Um, what was I saying? Sorry. Yeah. So the first week, just self-monitor as much as you can. Write down every little detail that you possibly can, and then after that first week, do a little recap and assess how much of your pooling is focused and how much is automatic. Focused pooling is usually easy to notice because you actually have to set a conscious intention to do that. So you make a conscious decision. Then in the second week, focus only on automatic pooling, because this is where you need to bring in more awareness. So you don't have to self-monitor everything all the time. Start with everything and then later on just zoom in on the more problematic aspects of pulling. After all, this is a behavioral intervention. It's not a profound philosophical reflection, so it's quite okay to be pragmatic and practical. Do you have a suggestion for awareness training when you pull as you fall asleep and don't remember it? Yeah, this is quite difficult. I've had this is not very common, but I've had a few clients who pull mostly in their sleep, and I think in situations such as this, self-monitoring might not be very helpful. What would be helpful is to actually use journaling before you go to sleep, or do something to relax yourself and release tension, because in general, we can see pulling as a way to avoid difficult emotions or as a way to just release some of the tension because it has that soothing effect. It provides that kind of release or even gratification. So make sure that you give some of that to yourself before sleep, but not by pulling. You can do a relaxation exercise, something like, I don't know, you have those hypnosis for sleep and stuff like that, or just a body scan, progressive muscle relaxation, breathing exercises. Just do something fun with a friend, or just take some time and then journal and put all your thoughts, doubts, issues, everything into that journal. That will provide some release before you go to sleep. And then what I recommend is that you implement a stimulus control technique. So fortunately for you, next month we will be talking about stimulus control techniques. So I will give you examples of a dozen at least that you can use. And I think a good chunk of these is also usable before you go to sleep. So that would be my approach to this. Stimulus control, unlike habit reversal training, doesn't require that rigorous awareness training because it has a different approach and a different goal. Is streak a mental health issue? Well, yes, it's yes. That's the short answer. It falls under the umbrella of what we call body-focused repetitive behaviors, and currently in DSM-5, it's basically considered to be on the OCD spectrum, although exactly where they place it changes every time when they reclassify it. Is it helpful when journaling to count number of eyebrows pulled so that you can see weekly progress? That's a good idea. I'm a little hesitant to say that this is a good idea for everyone, but if you think that this is how progress is measured for you, then that's perfectly fine to do. But it is very important to do something to mark your progress. I agree with this 100% because, as I said, if we just focus on the negative, then we will just train our mind to notice flaws, and then really we didn't do much except that we just kind of added more frustration to ourselves, and that means more pulling in the long run. So it's absolutely important. Actually, I should have maybe put a slide that concerns this as well, but I sometimes recommend to clients that they establish like a system of rewards, like a tier for, I don't know, like a day without pulling or 3 days without pulling and then a week without pulling, and then obviously make rewards progressively bigger. Whereas a daily reward is something simple and small, like, I don't know, like a candy that you like or some sort of guilty pleasure. Then like for 3 days you get a bigger reward and so on. So this is really helpful. When naturally what people tend to do is when they do something well, they just continue and just go about their life. But then once they make a mistake or if they fail, then they just start becoming frustrated with themselves. Our brain, when you tell yourself stop, don't do this, or you failed again, you're a failure, you'll never stop, and yada yada yada, all these things that people say to themselves, this definitely sends a message to your brain as in don't do that. But this is not very practical. Our brains are not that smart. No one actually is. Saying don't do this is not useful practical instruction for your brain. It's kind of like if you ask me what my name is and I said, well, my name is not Michael and my name is not Catherine. You still really don't know how to call me. And it's the same thing with this. If you validate yourself and reward yourself for something that you do well, you're actually giving positive instruction to your brain. When I say positive, I don't mean optimistic. I mean a direction, a specific direction to go into. So you apply a competing response successfully, or you have a day without pulling and you reward yourself, then there's like this little you inside saying, oh, okay, so this is how my days should look like. So reward works much better than frustration. Actually, frustration, yelling, being hard on yourself, none of that actually ever works, but it sure does make things worse. Does hair grow back properly after years of pulling? This is a question that's very hard to answer in definitive terms. I think it might be more useful to consult a dermatologist, or even better, just wait. Because it's quite unpredictable. I've had clients who have pulled for years and their hair always grows back when they go into remission and stop pulling. And then I've had clients who have some growth back, but their hair is not as thick and you know they don't have as much of it as they did before. And then I have had clients who unfortunately just never grew back the hair they pulled. But there's no specific way to tell what will happen except time. You do have products that you can use to apply and stimulate hair growth. There are vitamins that are specifically targeted to promote hair growth. You have that spray that you can use minoxidil but in certain like small percentage that you can spray on your head and it will stimulate hair growth. So that's something that you can do. And there are even pills that stimulate hair growth in one way or another. Most of that stuff you can get over the counter. You don't even need a prescription from anyone. But you should probably consult someone in case you have some other medication that you're taking. Do you do one-on-one sessions? So if you want to have sort of video sessions instead of the program, which is done in writing, you can reach out to our support team and then they will come up with a customized offer. Currently, we don't have a tier that includes one-on-one sessions, but we're working on creating one. So just wait for a couple of weeks. Actually, next week we have a meeting to discuss this. So we will probably create a special tier because this has been a request more and more. Currently, you have to ask. So you send your email to our support team and then they will come back with an offer. Whether or not that will be me, that really depends, but you can get one-on-one sessions. Does taking 3 milligrams of prednisone inhaled corticosteroid daily increase fidgeting and hair pulling? Well, there's no reason why inhaled prednisone would do that. Is it for asthma or some other condition? But there's no reason why it should do that. If you feel like you need, like you're, well, actually, I guess that depends. That depends how much of that prednisone gets absorbed into your bloodstream, because prednisone is basically acts in a similar way as cortisol, which is a stress hormone. So you might feel some effects of that, although 3 milligrams is not that much, I think. So, I mean, I've seen over the years, I've had patients who have autoimmune diseases who take much higher doses and they didn't experience such side effects. So I wouldn't necessarily say that this is why you have an increased need to fidget. Just consider that as being more anxious and more restless. Hair pulling is a reflection of that as well. How do you journal when you're not aware of the picking until blood appears? So that just means that a lot of your picking is automatic. So when you become aware of what you're doing, you sit down and then journal, and then just try to be proactive next time when you find yourself in the space where you did that once. Because usually, so I'm not sure when you say picking and blood here, I'm not sure if you mean skin picking or hair pulling, but regardless, BFRBs tend to be confined to certain spaces. And these are usually the spaces where we're either alone or when people are around those that are so close that you behave basically as if you were alone. So you have spaces where you have to be increasingly mindful. One thing you can do to increase your awareness is, as I said, just wear like a very heavy or noisy bracelet, because that will immediately put more attention on your hand. Or just wear gloves, because as soon as you touch your skin with gloves, because it is such a weird sensation and different than what you're used to, you will immediately become aware of it. So that's also a great way to do awareness training. It's also a good stimulus control technique. Should I write an entry if I don't get an eyelash, or only if I pull one out? If you feel the urge to pull, make an entry, but also make a note that you didn't pull. And then that way, I didn't talk about this here because there's only so much that I can fit into one webinar. But this is quite useful because then you can identify some factors that are protective, or certain capacities or strengths that you already have that in certain situations help you not to pull. So that's quite useful, because once you realize what these are, you can then consciously use them to even further reduce pulling. And if I have the need to pull, if you use our app, you will see that it asks you whether or not you actually pulled. So if you use the app, the answer is yes. The urge is also something to record, because even if you have like a slight urge to pull, but not so strong that you have to act on it, you can still learn about triggers. Remember, when I was listing things that you need to become aware of, triggers are one of them. So that will help you learn about your triggers. How do you handle going to the hairdresser when your hair is uneven from trick and they asked what happened to your hair? I actually think exposing yourself to situations like that is quite healthy, because this is, pardon my language, but presuming that your hairdresser is not a jerk. If they ask what happened, you just don't have to answer. You don't have to justify yourself to anyone. You can say that you don't want to talk about it, that you don't feel comfortable sharing, that's just what your hair is like, whatever. You don't owe an explanation to anyone. It's like rule number one of assertive communication. You really don't have to justify yourself. That's one thing. And the second thing why I think it's quite good to do that is because shame that surrounds pulling is often a very big maintenance factor as well, because it makes you hide from the world when you pull, and then it makes you obviously hide pulling itself and its consequences. So it remains in this kind of private bubble. But when you expose yourself to situations where people can actually see your hair, then it kind of removes the shame. So you remove one layer of triggers, you open up yourself to other people, and you're also far less likely to pull. It's actually also a form of stimulus control in a way, to just let your hair be visible. Do you have older adult clients who have pulled their whole lives, like for 40 years? Yes, I have had clients who have pulled for a long time. I think the oldest, although don't hold my word for this, but if I remember correctly, the oldest client that I worked with was 84 years old. So it's never really too late to start changing. The only thing that you need to know is that if a habit or an issue like hair pulling, which is obviously more than a habit, but even if it's a simple habit and it's been present for 40 years, it is that much more difficult to change, but it's still not impossible. Just be patient. I feel like my hair pulling at this stage in my life is only self-soothing behavior that has been so habitual for so many years. Is this possible, or is there always an underlying issue? Well, ask yourself, is there a reason why you would need to self-soothe? I would guess yes, otherwise you wouldn't do that. Like it's kind of like asking, is there an underlying cause for eating? Sure, hunger. And you are hungry because your body needs nutrients. So this is the same thing. If you need to self-soothe, that means that you were very unsoothed before. I don't even know how to say that word. So that means that you were tense or anxious or angry or sad or something before, right? And that would be the underlying cause. But as I said, you don't have to deep dive into your biography all the time. If that's something that you don't feel ready to do or just don't want to do, implementing habit reversal in itself should work, because when we test just habit reversal in studies, it is effective. But I will say that self-soothing already means that you're on the right track of understanding it. What is your view on NAC for pulling? My view is meh. The studies that we have show that it helps about half of the people who take it, and it helps them reduce their urge to pull by about 50%. It's typically not harmful if you don't use it for longer than 12 weeks. And if you use the recommended dosage, you really have nothing to lose. It's not even that costly. So why not? Try it out and see. You can only benefit from it. The only thing I would maybe caution you against is starting at a high dose right away, because sometimes it causes stomach problems for people. How much does the TrickStop program cost, and what is the average length of time folks do the program? The cost is $196 per month, I think, or less for the first month if you use the coupon code. What is the average length of time? So that really changes, but typically it's about 4 months currently. We have statistics that we've done a couple of months ago to see, because every time you start a new session, you do an assessment test, which basically tells you how severe your symptoms are. These numbers are not the greatest and the most reliable way to measure your progress, but they are certainly very informative. So when we notice big changes, it's something that we usually like to mention to clients and discuss. And we check these scores and how they change over time. And then what we realize that people who stay at least 10 weeks tend to benefit the most. There are two peaks that we noticed early on in the program. One comes after 8 weeks, and then the second one after 10 weeks, which is a bigger peak. So those are two major instances when people experience symptom reduction. So maybe that helps your answer. You can stay, as long as you want to. I'm not sure if this has been talked about, but is an identity shift or change necessary in order to not be a person who pulls as a stress response? Thank you. Well, I guess that depends. So it's kind of, it really, I guess I can build on the answer that I just gave a couple of minutes ago in terms of sort of what is the level of change that you want to achieve. When we in TrickStop, the program, when we finish with the habit reversal part of the program, we go on to implement acceptance and commitment therapy kind of techniques and ideas. And one of the things that we work with in acceptance and commitment therapy is to really just dive in a little bit deeper or higher, just whatever metaphor works. And then we talk about values and who we are. And then we talk about how these values connect to pulling in terms of how pulling prevents you from, working towards your values. And then, on another level, also sometimes how your values can actually sometimes lead to pulling, or at the very least, how the way you approach your values causes you to pull. So in that sense, sometimes that is a change that has to be made, but it's not always necessarily that you have to change everything about who you are. Sometimes it's just about finding the right balance of different sets of needs and values and just putting that in order. Sometimes it really does require a fundamental change. For example, many times we connect pulling to setting boundaries or avoiding conflict. In cases like this, if you have to learn how to deal with conflict, this can really have a lot of deep implications for one's sense of identity, because people don't just start avoiding conflicts because they have nothing better to do. Sometimes that's a response to, I don't know, growing up in a dysfunctional household, for example. And then you see your parents fighting all the time, and then you decide that you don't want to be a person that fights ever. And then conflicts become difficult, and then pulling becomes a way to release your anger or dissatisfaction so that you don't have to get into a conflict. For example, in that case, yes, the change that is required is kind of bigger. But everyone who comes to TrickStop, or I would say even if you work with a therapist, that's probably the approach that they will take, is that you will work first on just getting some degree of control over pulling by using habit reversal or some behavioral intervention, and then you will slowly dive in deeper. So you're always in control and you can decide how far you want to go and where you want to stop. So there are a few questions about the program and how it works and the cost of the program. So I already said most of these things. Next week, there will be a short webinar that's maybe like 10 to 15 minutes where I will present how the program works and then if you're interested in learning more, you can register for that one. And there I will explain exactly how our sessions are structured, how the communication works, how our therapists work with you, what to expect, how payment procedures work, and all this. It's not that I don't want to talk about the program, it's just that I think like if we already have like a short promotional thing devoted to this, it's best if I keep answering the psychological questions now. I'm having a complex post-traumatic stress disorder, and I'm very afraid of the awareness step. Do you have any advice? Just take it very slowly. I hope you have a therapist. I think maybe in your case, I wouldn't try to implement this as a self-help technique. I would find a therapist who can guide me slowly through this. When I talk about awareness, and if it is related to PTSD, it's not always, but if you do have it, likely there is a connection. Then you just need to take it one step at a time. And what I would start doing is focusing on those kind of banal external triggers. Is it seeing a mirror? Is it touching a hair? Or I don't know, sitting in a certain space? Like these things that will not take into account a lot of your internal factors. And then slowly I would go into those triggers as well. Because pulling is an avoidance mechanism, and sometimes it can be a way to avoid painful memories or very harsh thoughts and things like this. So if you have PTSD, the best place to start is with the outside world, and then slowly move inward. That's what I would recommend. Another thing that you could do for awareness training is to actually find a mindfulness teacher who knows how to work with PTSD, because mindfulness can actually be quite beneficial for people with PTSD, but you just need a teacher who's actually a therapist or at least trained to do this. And then they can teach you certain techniques, because mindfulness raises awareness. That's basically what the whole technique is about. But at the same time, mindfulness can have a very soothing effect, and the right combination of techniques could also be helpful. Just really make sure to find a teacher that you can work with one-on-one and someone who actually knows how to do that. Is there any specific medicine that you suggest? Well, I can't prescribe medication online, so I stay away from those recommendations. I will say, though, that the studies that we have for now that compare medication versus psychotherapy always wins. So that's a better way to go. You can consult a psychiatrist offline, and they can prescribe, usually it's antidepressants. So that's also an option. They work, as I said, just not as well as psychotherapy. I find myself getting frustrated when I become aware of my pulling, then I pull more. One of the topics that are proposed but were not chosen is self-compassion. So maybe you can Google more about that and learn a little bit more and apply some of these things. I think this is very illustrative because it shows something about how you relate to yourself and how you treat yourself, and then also maybe why pulling is a problem. So try maybe doing, once you become aware of your pulling, maybe try doing a breathing exercise, something very simple like box breathing. That's very easy to learn. It takes about 10 seconds to learn, and that should calm you down. Thank you so much. This was very helpful. I never considered it maybe an avoidance. I never considered it may be an avoidance of dealing with emotions or anxiety. I have been on my mild side for decades. Recently, I got a dog and have only pulled like 5 hairs once since. Well, as a dog owner, I will say that dogs are a cure for nearly anything. We have, if you're interested in learning more about this, we had a webinar last year that was called, I think, Emotional Avoidance. And the whole webinar was just about that, how avoiding processing emotions leads to hair pulling. So you can look on our YouTube channel and find it. And if you can't find it, just send me an email and I will find the link for you. But that is one of the kind of staple ideas of acceptance and commitment therapy. I'm 24 days pull free. Congratulations. I usually don't go beyond 1 month and I will relapse. Please suggest how I can sustain it. Thank you. So first of all, the way you phrase this is already self-defeating. You're 24 days pull free. So you have 1 more week to break your record. I don't know what techniques you use since I don't have enough information, but use stimulus control, but I guess you can't wait until next month. Use competing risk, just whatever you're doing, be extra cautious and try to be prepared when you enter stressful and triggering situations. Because sometimes, I don't know if this is the case for you, obviously, because you wrote one sentence, so I can't possibly know, but there are, if you pull, let's say, in certain spaces, and if you tend to get lost in pulling, then the best way is to be proactive and you either avoid those spaces or change them up so that they're not as conducive to pulling as they would be normally. We'll talk about this a lot more next month, but that's one thing that you can do. Also, if you need any specific advice, you would have to tell me everything, not everything, but what is it that you're currently doing not to pull, and just email me and I will respond either tomorrow or on Monday. My scalp often feels itchy and the place where I pull, is there something I can put on it to relieve the itch? Thank you so much for these webinars. You're welcome. And yes, you have a lot of over-the-counter anti-itch creams that you can use and lotions as well. Like you have them at CVS and Walgreens and places like that. And another thing that you can do is just buy a strong anti-dandruff shampoo because they usually use either zinc or these kind of soothing substances like, I don't know, like mint extract and stuff like this. So they will reduce any inflammation that you may have. Something that you can also do, but I really don't recommend that you use this more than a few days in a row, is to find a cortisone cream and then put it on the place where it itches. It is quite good for this. It's just not meant to be used long term. As a general rule, you don't want to use corticosteroids on your skin for a long period of time unless specifically your dermatologist tells you. But cortisol cream is over the counter and you can use it for this as well. Can stimulants like Adderall make trick worse? Yes. In my experience, they have like both effects. And I think that might say something about why people pull to begin with. But since I don't have any access to research grants and facilities, all of you who do, email me. I can give you a research proposal. So I've noticed that there are some clients who will start taking ADHD medication and then they will reduce their pulling very quickly. And this is because when your attention wanders all the time, it becomes very frustrating and anxiety inducing. So pulling is again a soothing mechanism in that case. And then what happens sometimes is that as the effect of the medication wears off, then you start pulling again. So it may appear as if Adderall is triggering even more pulling. And I have heard a few clients say that really genuinely pulling even began once they started using ADHD medication. So the short answer is yes. I need to get used to giving the short answer first and then the long one. Are there any competing responses that specifically deal with the scalp instead of the hands, like a compression hat? So anything that you would put on your head to prevent pulling would be stimulus control, not a competing response. A competing response is something that you do. So it's a habit that you actually actively perform. Whereas if you wear a hat, for example, I guess that's something that you were referring to, that would be stimulus control. So that's something that we will be talking about next month, and the entire webinar will be just devoted to these techniques. I have been pulling for over 50 years. Is it possible to learn to stop? Yes. I have a very short answer to that. Are there any medications that you have success with to overcome pulling? Anxiety meds? So anxiety meds, if you mean like benzodiazepines and stuff like that, that really does not help very much with pulling at all. What helps, certain kinds of antidepressants help. There are studies that show that some mood stabilizers can be mildly helpful, that certain antipsychotic drugs can be helpful, but these are the kinds of medications. So these are just studies. I have to underline this because I don't think that many normal psychiatrists would actually prescribe a toxic medication. Like some mood stabilizers can be quite toxic. I don't think anyone in their right mind would prescribe that so easily for hair pulling, but antidepressants, for example, can be prescribed because they're not very dangerous. So that's something that you can consider. But as I said, I think this medical side, I would really just prefer if you consult someone in person for this, because you do need a prescription for it. The reason why I'm skeptical, by the way, about medication, I'm less skeptical about antidepressants because if they don't help, they don't do a lot of harm either. But other kinds of medications that were tested in studies can have serious side effects, so they're not something to use lightly. And the studies that have shown that they work are typically very small. Some of these studies have like 25 participants. That's not sufficient to do statistics at all. I mean, they do them, it's just not very reliable. So in that sense, I take these studies with more than a grain of salt, with many grains of salt, because they're so small and because there's not a lot of them. Very often you have one or two studies that show that a medication is effective, and that's really not enough in science to say that, okay, this works for most people. These studies are promising, but all you can conclude from them is that we need more research. Have you ever heard of someone whose hair pulling started a few months before being diagnosed with a brain tumor? In my case, at the age 45, GBM, you mean like glioblastoma? Or it's a shortcut for something else that doesn't come to my mind now. So there are certain case reports, to my mind, that I can think of now, not necessarily relating to brain tumors, but I have read a few case reports that associate hair pulling, but in very specific cases. So this is not common experience or a common cause by any means, by certain neurological disorders. So obviously, a brain tumor is bound to cause neurological issues. So I wouldn't say that it's impossible or even unlikely. That also, by the way, doesn't mean that habit reversal wouldn't work for you. In my case, I like the pain of pulling my hair. Yeah, this happens quite frequently, and also with skin picking as well. That doesn't exclude, again, habit reversal. You can still use it, but what's worth exploring is why is it that pain provides self-soothing, because that is the most common effect that hair pulling has. It's really that's something where I think as a therapist, I would be intrigued to dig a little deeper and understand the significance of it. But that's just a hunch based on experience. Perhaps it doesn't matter to you. What is the name of the medication that suggested to take no more than 12 weeks? I did not hear the name of it. NAC, N-acetylcysteine. It used to be considered a supplement, but recently FDA reclassified it, but I don't remember how. Someone told me in one of the webinars. I Googled it, I vowed to remember, and then I immediately forgot. But it's still available over the counter and you can take it. And you can even find studies online. You can download whole studies for free to see its results. Sorry, I entered late. What can be the cause of me pulling my hair? So it can be many causes for hair pulling. I guess the most generic answer that I can say that usually is accurate to an extent for most people is that pulling is an avoidance mechanism so that you don't have to process difficult emotions. It's essentially a way of regulating your emotions. Do you guys take insurance? In principle, the way that we work is that your insurance we issue you an invoice every month, and then you get reimbursement from your insurance company. But that really depends on your insurance company. So it's wiser to reach out to them and then see if they will cover the program. We've had clients who were covered for months and months on end. Then we've had clients that got coverage for 2 or 3 or 4 months. So that really depends on insurance companies. I tried the Trick Journal app, but I put in longer time pulling than I pulled only to have extra time to pull while German. Is this self? I don't understand exactly what you're asking. Can you please rephrase the question? If I understand, it takes more time to log than you actually pull, or you log quickly so that you can continue pulling. I'm sorry, I really didn't understand the question. To the scalp question, you answered my question. Thank you. This is my first webinar and it was so helpful. You're welcome, and join us next month as well. I have invented for myself an A4 sheet with 3 different colors of little stars. I use a post-it, put the date at the bottom and week and number, one, and put a star if I have not pulled with hair. Sorry. So you put a gold star if you didn't pull at all, silver for light fiddling and no pulling, and then a copper star for a tough one. And then you reward yourself monthly. 5 months without pulling for now. I have this somewhere I can see all the time. I have titled it the Trichotillomania Remission Week Number. That's a very good way to go. And because first of all, the color, I like the color coding as an idea. And if you don't mind, I will probably steal your idea and recommend it to clients because I think it's very useful. And yeah, rewarding yourself really does work. People think it's silly, but sometimes these silly things are remarkably effective. I'm really happy to hear that. And 5 months is some remarkable. What are your suggestions for a toddler who pulls their hair out? So that depends on the age, but a toddler implies that the number is quite low. I would suggest that you do stimulus control techniques. If someone is that young, it's very difficult to explain habit reversal, but you can try implementing competing responses. Just make sure to find the right ones. It can be a little difficult. So I think the easier way for you to go is to use stimulus control techniques. And we'll talk about them next month. So join us and then hopefully you'll get more useful advice. Can hair pulling cause neuropathy? No specialty doctor has given me a reason for it. I'm not diabetic. No, not to my knowledge, and thinking theoretically about it, I don't see why it should. But if you have a neuropathy, then there obviously is a cause. It depends on what type of neuropathy you have. Neuropathy just means that you have a kind of damage done to your nerves, but not by inflammation. That's just what the word means. And you can have a number of causes for them, and sometimes they're idiopathic or essential, meaning that we have no clue what causes them. But then when we have no clue what causes them in medicine, we just invent a fancy word like idiopathic, and that makes us sound very smart. But what I'm saying, I guess, is that even if they don't know the cause, it's probably not hair pulling. I can't imagine why it should be. Let me see if there are other questions that I didn't. My partner has the hair pulling disorder. How can I help? Um, I suggest that you talk to your partner about this because sometimes people really don't need help or don't want help, or they might need specific kind of help. So my suggestion is that it's fine if you learn and inform yourself about hair pulling, but if you want to participate in your partner's treatment, then just ask them what you can do and listen to them. And also your partner, if they haven't sought treatment yet, they might not be ready. So reminding them of this and mentioning it all the time might actually be counterproductive and just cause resistance. So just try to have an open and honest conversation and see what they say. Okay, I'm going to answer one more question, and then I think it will be a good time to wrap up since we've been at this for an hour and a half at this point. If I pulled 5 minutes in a day, I entered 15 minutes pulling in the app and pulled for 10 more minutes right after the enter. Oh, okay, well then just make another entry. It's very simple. Okay, let's do another question, and then because there's a number of them that I didn't get to yet. Thanks a lot for your webinars. I wear a bandana at home and a wig when I go out, but I still somehow manage to pull unconsciously in private while wearing them both. Do you have any simple tips I could use to prepare myself before the urge to pull? Well, if the urge is that strong, just wear gloves, for example. They will prevent you from pulling physically. Sometimes wearing acrylic nails also helps, but that depends, I guess, on how you pull and also what your aesthetics are like and whether or not you like them. But they will all be physical barriers so that you can't pull. Acrylic nails especially because they're not that easy to remove. Okay, so this is a good place to stop. I see that there are a few questions that I didn't get to and some questions that are still arriving. So please, you have my email here in the lower left corner. Just email me your question if you don't want to wait until the next webinar, and I will respond either tomorrow or on Monday. Thank you very much for staying with me for so long, and I hope to see you in December. We will be talking about stimulus control techniques. Have a pleasant evening, everyone.